the expectations is that you're gonna keep your camera on, and that's because I really would like to see your expressions, your reactions. As you might know, EMDR is a therapy that is part of somatic therapy, other somatic therapies. So it's really important for me to see your body language and to see how you're reacting to the training. Now, it's also true that your icon is very small, and I'm not 20 years old anymore. So sometimes I think, do I really see something actually from that small icon? But at least I can try to do so. And the other part that I already mentioned, no question is a stupid question. Just ask anything, even ask to repeat or saying, I don't understand anything anymore. You're just contradicting yourself. Don't be shy. Ask everything you want to ask. Be ready to feel confused, to feel anxiety. We know it's part of learning. So just ask when you have those feelings, but also be open because it will happen. Try to get on time so we can use as much the time we have as possible. The attendance is recorded as with all your other didactics here by the region. And if you have to take a break, but leave the camera on. Point it to the ceiling, put something on it, but leave it on. Don't turn the camera off. And then it's possible. I mean, there are always exceptions, right? And the practicum in the afternoon is required. That means that it's an important part of the training. Maybe the most important part of the training, and when you start with your peers to use your new skills, new interventions. And we will ask you, even if not immediately, to do not real role play, but real play. Sometimes we might use vignette, but most of the time we are trying to use something that really happened to you in your life. Now, please be responsible. When you use real material from your life, don't use something that has been deeply traumatic for you, that can put you getting you emotionally dysregulated or put you at risk. Use something mild. An interaction with your landlord you didn't like. Not really, the trauma you had with a sibling of yours. Just try to find something that is mild, but still does provoke a little bit of disturbance. And I'm sure you can find plenty of ideas, because the life of a human being, as we know, pain is part of our life. These kind of experiences are part of our life. So in order to make the practice more useful, just try to find something that makes sense with those boundaries. And if something unexpected happens, if you have a memory that comes up that you forgot, or please contact Mary and me immediately, and one of us will take care of you. Usually nothing happens, but just in case. Okay? And we'll try to have you working in groups of 2, as much as possible. Better if you work with somebody maybe you don't know that well. But it's not really a must. So the important part is that we will all engage in this practice. And during the practice, Mary and I will go from break room to break room to offer direct feedback. It's actually the best consultation you can get, is us coming, listening, and give you direct feedback. It's painful, because it's painful when somebody is observing you. You feel like a bug under the microscope. I understand, but it's also useful. So practically what I'm going to ask you for real is embrace the pain of feeling a beginner therapist again. It's gonna be all over like when you saw the first patient. It is painful. And yet, since right now my job of serving you is trying to get you learning and practicing this new therapy, um, it's part of the way you will learn.